Hey fam, I'm taking a break from studying to bring you this test taking tips video. I was successful in my first semester. I got 3 B's and 1 A, and I credit using these 10 tips for helping me during tests. Nothing will substitute knowing the material. No matter how much you take these tips to heart, if you don't know the material, you're going to fail. So once you've done all your studying, your reading, your note-taking, your study guides, whatever you do, listening to videos, watching videos, or whatever, then it's time to actually take the test. I know some people have anxiety when it comes to tests, or I don't know, I just drank something and it just like went down like the wrong pipe. Terrible, terrible. When you have test anxiety, it just helps to have these little tips to remember to help you make decisions when you're in the test. So, number 1, we don't speak in absolutes when it comes to nursing. So if you're stuck between 2 or 3 answer choices and one of them says something along the lines of always or never, it's probably incorrect. Like, we always treat elderly patients the same. All elderly patients with diabetes, we treat them the same. No, we don't always treat them the same. We always individualize care to the patient. So yeah, we don't speak in absolutes. Keep that in mind. 2, we don't do extreme temps. If the answer choice says hot, very cold, we don't do that. We don't use a hot compress. We might use a warm compress, right? We might use a cold compress, but it'll never be very hot, extremely cold, very cold. No, we don't do extreme temperatures. Number 3, we never try to pass on implementation or care that we are licensed to do. So like, if a patient asks you a simple question that would within your purview, you would never say, I'm gonna wait for the doctor to come in to explain that to you. Not when you could explain it. Or the person is asking like a spiritual question or something, you would not say, oh, I'll call the rabbi for you. No, you would listen, you would empathize, and you would be there for your patient. So if it's like, if one of the answer choices is to like pass it off to another member of the healthcare team, that it's wrong, it's wrong. Number 4, we never dismiss the patient's thoughts and feelings. This is all about therapeutic communication. This one was a little difficult for me to like kind of master, but once you grasp this concept, the right answer choice will be there for you. So when it comes to therapeutic communication, you never dismiss what the patient says, even if what they're saying is incorrect, or if their feelings are disproportionate to the situation, or their thought process is wrong. You never dismiss what they have to say. Typically the right answer will be to just reiterate what the patient says without agreeing or confirming or denying, just repeating like, oh, I hear you saying da 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 da. So always think therapeutic communication. Let's see, where am I? Number 5, real world and school are 2 different things. If you choose your answer choices based on what you see, like if you have prior medical experience, or if you go to clinicals, and if you do what you see in clinical or in your experience, you're going to fail. School is like the perfect hospital, the perfect world. Also, this goes into like, you shouldn't read more into the question than is already there. You know, like, your patient is perfect. There is no outlying situation that you should be worried about, especially like in like your first semester. It's the perfect hospital, perfect patient, perfect world. This is NCLEX, this is ATI, this is school, it's not the real world. Just keep that in mind. Number 6, know the vital sign ranges backwards and forwards, because you don't want to miss the easy questions because you forgot the proper range of respiratory, 12 to 20 breaths per minute, for heart rate, 60 to 100. I'm so sorry, guys. This water went down the wrong tube. You need to be able to like regurgitate vital sign ranges like it's nobody's business. And for temperature, know it in Celsius and in Fahrenheit. And if you just have a hard time, like I have a hard time kind of remembering it in Fahrenheit, the Celsius is easy. It's 36 to 38, right? It's such an easy round number. So sometimes I might calculate, if it's in Fahrenheit on the test, I might calculate it really quick. So if you know the conversions for Celsius to Fahrenheit and whatever, you can hack these things. So know your vital signs backwards and forwards. 7, a lot of fundamentals and even adult health assessment is all about the ABCs and Maslow's. Airway, breathing, circulation, and Maslow's hierarchy of needs. And I find that the ABCs usually is the one that the test is focused on: airway, breathing, circulation. And I noticed you never see airway, breathing, and circulation all on the same question. It's typically like something having to do with a treatment and then airway, or a treatment and breathing. And like 3 options are treatment, and the next one is, and the 4th option is circulation. So just keep that in mind, and you are going to get a lot of questions right because you chose the correct item to implement first. Priority. Oh God, this is like a major one. Priority is so important, and it kind of goes hand in hand with the ABCs and Maslow's. On your nursing school questions, all of the answers are going to be correct, and you're going to have to choose the most correct answer. So it's like, it may say something like, a patient comes into the hospital with shortness of breath and and complaining of chest pains, and they have a heart rate of whatever, a respiratory rate of this, and blah, 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 blah. And then like your answer choices will be take vital signs, send them for some type of like imaging test, like a CT or MRI, or whatever, something like that. Administer aspirin, give a breathing treatment, something like that. And then assess the patient's whatever. So in this case, you're gonna have to know the nursing process backwards and forwards. Typically, when it's asking you what do you do first, it's asking you a nursing process question. So am I going to assess first? Am I going to diagnose? Am I going to plan? Am I going to implement? Am I going to evaluate? And as you read the question, you can see what stage they are in. And most likely the answer is assess. If you haven't seen them assess, you don't see any other steps of, you don't see any steps of the nursing process has been done, you're gonna assess. Point blank, period. But like, let's say the question is advanced and it's saying that the nurse has already given the patient I don't want to make up a wrong number. I've only had one class of second semester pharm. Well, let's say they got like a pain medication or whatever. Well, you just implemented. If you did something, you implemented. So what's the next step after implementation? It's evaluation. So just keep priority in the back of your head. So number 9, test taking tip, select all that apply. These are so difficult because there's no way around having the necessary knowledge to be able to answer the question. Select all apply tests whether or not you actually understood the material. So what you have to do is you have to look at the question, read it, and then look at the first answer choice and treat it like it's a true or false question. Does answer choice A, does it apply to the question? Is it true when it comes to the question? Is it false? You do the same thing with all the answer choices. And then when you're done, you don't second guess yourself. Everything that you said is true gets clicked, and everything that you said is false doesn't get clicked. And don't trick yourself. It could be none, it can be one, it can be all. You just have to know the material. And then my last test taking tip is, if you really just don't know the answer to the question, look for key words that will disqualify an answer choice. You may not know what the heck this question is asking you. You may not have the knowledge to answer the question, but there may be something in the answer choice that makes you go, that just don't sound right. That doesn't vibe with what other stuff I have learned, and it just don't seem right to me. So you're gonna rule out choices that just seem wrong or sound wrong, and then you're gonna make a really good educated guess, okay? So don't be discouraged if you don't know the answer. A lot of the time in fundamentals, they're asking you questions that are really advanced, like the content of the question is way past fundamentals. They're not testing you on the content of the question. They're testing you on the ABCs, on priority. They're testing you on the nursing process. They're testing you on on whether you understand safety, patient safety. They're testing whether or not you understand therapeutic communication. So just never be scared by these questions. Yes, some you definitely have to understand and know the material, but if you can just like get priority like squared away and the nursing process, you're off to an amazing start. I really hope this video was helpful for you, and that you all kill your first exam of the semester. I'm so proud of everybody. Hang in there. Before you look, I think we're about to head into week 3. Isn't that crazy? Going into week 3 of the semester. I have my first, I heard the fundamentals kids have their first test this week, and I have my first test of med-surg the following week. So y'all, we in this thing. Kill it. I love you guys. God bless you. Bye.